In this video, we're going to be talking about what tongue tie is, how it's diagnosed, and what treatment is available if your baby is found to be diagnosed with a tongue tie. So, what is a tongue tie? Now, underneath everybody's tongue is a piece of tissue that connects the tongue to the floor of the mouth, and we call this a lingual frenulum. Majority of the population have this frenulum, and it's actually normal anatomy. So after you've watched this video, go and have a look under your own tongue and see what's underneath. Everyone's is slightly different, but in about 10% of the time, these frenulums can be quite short or restricting the movement of the tongue function. Now, if the tongue is restricted, this can impact on feeding. So for effective feeding in the early weeks, months, days, we really want to be able to have the baby extend their tongue over their gum, come up, and then do this really nice wave-like motion. If the frenulum underneath is short and restricting, then what it's going to do is pull the tongue backwards, and this can cause problems with feeding. In this instance, we would call this a tongue tie. The tongue is tied to the floor of the mouth and it's impacting the movement of normal tongue function. Now, lots of people think that we can look for a tongue tie at birth and that's how it's diagnosed, but that's just not the case. Because although we can see that there is clearly a frenulum, or perhaps maybe not a clear frenulum, we can't quite see if it's impacting the movement of the tongue until your baby starts using their tongue, and they do this through feeding. So a really good feeding assessment by someone qualified to assess a feed, and also taking in the history that you've been reporting about how feeding is going, as well as a good look at the tongue, will help us to put all the pieces of the puzzle together to decide if this frenulum is impacting the movement of the tongue, and therefore treatment might be necessary. So, what does the procedure actually involve? First things first, you'll be booked in to see a tongue tie specialist, and these are usually midwives who have done extra training. They will look at the function and appearance of your baby's tongue with their finger. They'll do an oral assessment and they'll ask you about what the feeding problems are that you're having. They may want to watch a feed as well so that they can see what your baby's tongue is doing during the feed. Once they've put all of this information together, they will tell you whether they believe that your baby has a tongue tie or not and what options you have available. They may offer you a tongue tie release, and we call this a frenulotomy. Now, this is classed as a low-risk procedure. However, we are creating a wound under the baby's tongue. And what happens is we lift the baby's tongue up, and with some sterile scissors that are round on the ends, so there's nothing sharp going in, we'll press down and release that band of tissue so that the tongue can be released from the floor of the mouth. Now, in the early weeks, babies don't need any pain relief for this. There's very, very minimal nerve endings in it. And usually a good feed is all they need straight after, and lots of cuddles. Because we're creating a wound under the tongue, there is a small risk of things like bleeding and infection. You can get more information about tongue tie specifically on our tongue tie section on our website, where we have a patient information leaflet. This talks about signs and symptoms of tongue tie, how we go about releasing a tongue tie, and any risks that are involved. You can speak to your midwife or your health visitor if you think that your baby may have a tongue tie, and we can organise getting you reviewed by somebody trained in tongue tie assessment and division.